Hello, my name is Mary Frances Coryell. I serve as the Chief Revenue Officer for Ivy.ai. I've spent the last 20 years of my career focused in emerging technologies that are solving big problems at scale. Today, chatbots are not widely used in healthcare. However, that is emerging very quickly. When we think about the healthcare market, the chatbot technologies have been focused in three key areas. One, providing medical information, think COVID-19. Two, from the sake of handling processes, scheduling, prescription refills, registration. And third, from the sake of gathering patient information. Over the past 5 years, we have seen an uptick in the use of chatbots. However, a key component to that drive has been the rise of e-health. So when we think about the accessibility and equality that folks are trying to bring to healthcare, and the fact that now it's equal for homeless folks as well as physicians and clinicians to have a smartphone, chatbots are a key component to bringing that equality across the space. The digital front door is based in a phenomenon and a strategy around engaging patients across their journey at the key touch points with technologies that they're common in their everyday space. The patient experience today is one that is demanding 24/7, 365 access to information and resources. Chatbots enable clinicians and healthcare institutions to make that happen at scale. When we think about accessing healthcare, a big challenge of today are the silos that have been created within healthcare. By bringing in AI technology, you begin to break down those silos and create a unified patient experience, while at the same time generating data that helps you to know where you can continue to grow in the future. Ivy.ai recently launched some new technology called Genie, which is a self-building chatbot. This enables institutions the ability to quickly stand up chatbots with custom information and not have those barriers of something that is static, the same, and draining of resources from an implementation perspective. The barriers to incorporating chatbots today consist of three components. One, from the sake of ensuring that what is unique about your institution, your organization, is brought forth with that chatbot. Some companies out there build chatbots through surveys, only utilizing workflows. That creates a very static chatbot that then feels the same as everyone else. You begin to lose your marketing edge. The second component to that is beginning to look at that cultural shift. Prior to now, all of our teams have been focused on transaction. We want to begin to shift our teams to be thinking about how they can take an inch today and training that chatbot to ultimately gain a mile tomorrow. Again, that cultural shift is often challenging as you look across hundreds and thousands of staff members and patients. When we think about the third limitation, it's very focused in resources. It's very daunting for a team to be looking at an implementation that may take weeks or months. This new Genie technology removes that overwhelmed feeling of your team members and helps them to see that they can have this bot stood up and supporting them within a matter of minutes and days. future of chatbot technology in healthcare is truly creating the unified patient experience. Up until now, we've seen chatbot companies that are very focused in niche use cases, simply scheduling or registration, but a patient wants connectivity across that journey. The future of chatbot technology will break down those barriers and create that cohesion that they seek. The future of healthcare technology will become no longer a one. And when we talk about a one, meaning a one option, a one solution, people of today are demanding omni-channel access, options, things available on different channels at different hours of the day. An 8 to 5 model is no longer going to work. And that's not just from the sake of the patients, but that's also from the sake of what clinicians and physicians seek for their lifestyle as well. With that, we will then begin to have further focus on data, that being making records more readily available, and data that is truly driving efficiencies and proficiencies for not only the patient care, but for the teams that serve them.